Hello, welcome everyone to Big Easiest Ways to Wellness. I'm your host, Integrative Psychiatrist MacKenna, and I have a very special guest today, expert of sorts, another integrative psychiatrist and a sleep expert, Dr. Nishi Bhopal, and she has been gracious enough to agree to come talk to us. I've had so many people reach out to me about sleep, especially during 2020. 2020 is like the year of no sleep, because it's the year of all the things happening that we don't want to have happen. And so I thought having a sleep expert come on would be helpful for everyone, myself included. And so with that, Nishi, welcome. Thank you so much for joining us. I really appreciate you tuning in from sunny California, right?
Yes. Well, yeah, not so sunny today, a little bit foggy today here in the Bay Area, but yes, no, thank you so much for having me.
Yeah, tell me a little bit about your journey and how you ended up kind of becoming an integrative psychiatrist and then following this journey towards sleep being your jam and what got you there.
Yeah, so when I was in med school, I actually didn't plan to become a psychiatrist. I applied for internal medicine. So I started out my residency training in internal medicine, and I went through my intern year and I just found myself talking to my patients about their lives and what was going on in their relationships and did they enjoy their jobs and like all these other aspects of health that we just weren't addressing in the IM clinic, you know, where you have 15-minute visits and you're refilling meds. So I started to realize like maybe I'm in the wrong specialty. Maybe I should have gone into psychiatry. And psychiatry was always kind of another option for me, and it's something I'd considered, but I just didn't choose it at the outset. But after my intern year, I realized that, you know, I was in the wrong specialty, so I ended up transferring. So I finished my intern year in IM and then transferred into psychiatry. And so when I was a psychiatry resident, a lot of my patients had issues with sleep. And I felt like we didn't get a really great foundation in how to address those issues in psych training. And so actually one of my senior residents in IM was going into a sleep medicine fellowship. And I never heard of that. I was like, what? That's even a thing? Like,
I know, right?
Yeah, I was like, okay, that's interesting. So I started exploring that, and there was actually a really great sleep department at the hospital where I did my psych residency. So I started doing some rotations with them and just like spending a lot of time in that clinic and talking to the other doctors there. There was a couple of psychiatrists in that clinic. So I just found that really exciting. And what I really loved about it was, well, one, I got a really great foundation in how to help my patients with their sleep issues. Because as we know, sleep is so foundational to mental health. So if you're not sleeping well, it's not going to help your depression or anxiety or bipolar disorder or what have you. So you need to have really good quality sleep in order to get a handle on those other issues, right? And there's this bi-directional relationship that we can talk about. But so I really loved that. I was getting a good foundation in how to help those patients. And also I love, like one of my patients calls me a quant because I love to measure things, right? And so in psych, we don't have a lot of great ways to measure things, right? So a lot of it is based on clinical interview and history. So I loved being able to see an EEG and see the breathing patterns and their O2 sats and everything, and like really have something visual that I could measure, where I can measure my patient's progress and diagnosis. So I love that aspect of it as well, the technical piece too. So I ended up, finishing my psych residency and then going into sleep medicine fellowship, which was another year of training after psych. And throughout this whole process, I also got into yoga and meditation through my own journey with personal development and burnout and dealing with my own anxiety and managing all of that. So that opened me up to this whole world of integrative medicine, which I'd always kind of been interested in, but through my own experiences, I started to realize there's another dimension to health and healing that we weren't really addressing in conventional medicine. And so that kind of got me interested in exploring other healing modalities. And I started learning a little bit about Ayurveda and integrative medicine. And so that's taken me down this whole path. So now what I do is I kind of bring all of these elements together into my clinical practice. So I have a private practice where I bring in elements of integrative medicine, integrative psychiatry, and sleep. So it was kind of like a circuitous journey, but yeah, I mean, to me, it's so exciting because there's, you're constantly learning, right? Like there's just always new developments coming up in the field of sleep and circadian medicine and integrative medicine. So it's been really fun for me.
Yeah, it's funny from talking to folks. I'm in the integrative medicine fellowship right now, and just looking at folks like ourselves who've done kind of the integrative way of thinking, it seems we all have different kind of pathways to getting there. Because I actually started on pediatrics. I don't know if I had told you that. And then ended up in psychiatry, and kind of, similar as far as journey taking me into meditation and things that I hadn't even really considered medicine, to be honest.
Yeah.
And it wasn't until I realized I was happiest addressing the entire person in front of me and not just like neck up.
Yes.
That I realized all the things that I've been doing in my own life are things I could actually bring into the room and help the person across from me, or into the, the Zoom room and help that person. So that's always so fascinating to me when I talk to folks like you that are kind of on a similar journey with integrative medicine and how they brought in different parts of their lives. And I just love that so much. So it's funny that also that you started being interested in sleep during training, because I just can't help but think of how during training we get so little sleep.
Yeah.
I mean, I'm here in New Orleans and I hear streetcars going outside my my office. And during my pediatric residency, I got hit by a streetcar in my car because I decided to make a left turn in front of the streetcar. I was post-call. Like, I know, I was exhausted. I was exhausted.
Yeah.
And so I think part of why some of us in medicine are kind of not as uncomfortable with what's going on with the pandemic is because we're used to that kind of chaos of not getting enough sleep, maybe not eating great, all the things, not good things at all. No, this is why, people don't live as long. But, so many people now are living that life of not sleeping well, maybe not eating well, maybe eating at all hours of the night. And they're coming to me, and, like I said, when we first opened, and saying, Dr. Holly, like, I can't sleep. What is up with that? I mean, I have folks reaching out to me on Facebook, social media, friends of my husband's, just anything you can tell me about sleep. So if I'm that person who's really just not getting enough sleep, is exhausted, probably feeling overwhelmed and anxious because I'm not getting enough sleep, like I said, probably not making the best choices with eating, where do I start? Like, what do we do to begin with to get us back on a journey that's going to help us sleep through the night?
Yeah, no, I mean, it's such a big issue, right? So like, we're already an inflamed and stressed out society at baseline, and then you throw a pandemic on top of it, right? So it's like, it just throws everything into disarray. And one of the unique challenges, I think, with this pandemic is that a lot of us are working from home, right? Like, we're in our home offices all day. There's no separation between home life and work life. And if you have kids, then you're doing distance learning, or, we were just talking about taking care of our dogs, and, all of these other things that we're doing that, are just kind of all happening in one space. And so that in itself creates some confusion for the brain and for our system, right? So we're losing a lot of the anchors and the routines that kept our sleep-wake cycles in place. So, and so this ties into the whole, circadian rhythm and regulation of the body clock. So that's a big issue that I've been seeing in my practice as well. So a few things that I'm recommending to people. One is to create some anchors for yourself, because, so all of these things are kind of blended in, right? So you get out of bed, you roll out of bed, you might not even put clothes here, like,
right?
Like,
I wore my PJs to walk the dog this morning. I own it.
Exactly. That we're missing. So simply, like, putting on your work clothes, putting on makeup, commuting to work, all of these things that we sort of took for granted have been thrown out the window. And now, like, everything's just kind of blended together. So a few things that I'm recommending to people, especially if you're working from home, definitely create an anchor for yourself where you're getting dressed, right? Okay, so maybe leggings on the bottom, or, sweats on the bottom, that's okay. But at least put on a nice top, maybe do, put on some earrings, put on some makeup, do your hair, shave if you're a guy, right? So do those things that you normally would have done if you were going to work. So you're creating that little bit of a signal or a cue to yourself that, okay, the morning is starting, my day is getting started. Another thing is to use the time that you would have used to commute. So if you used to have a half-hour commute or a 15-minute commute, or an hour, or whatever it would have been, use some of that time to actually go outside and go for a walk. And this will do a few things. One is it's going to signal to your brain that it's daytime, that natural light, that bright light from outside is going to suppress melatonin production, right?
Okay.
So melatonin is produced in an environment of darkness. And if you're inside all day and if it's not super bright, we're getting into the winter months, it's a little bit darker. Even here in California, in the Bay Area, it's a little bit foggy and dull. So you're not going to feel fully awake unless you get that dose of bright light. So what I'm recommending is to go outside, go for a walk, get a little bit of exercise, and get that bright light to suppress your melatonin production, so it'll help you feel more awake and alert. So that's a really simple thing that you can do first thing in the morning. Another thing I recommend to anchor your circadian rhythm is to take a midday break, right? So a lot of us are working from home and we've got meetings all day or whatnot, and you kind of just work through your meeting, or maybe you're scarfing something down while you're, checking your email or whatnot. Whereas maybe if you were in your office, you would have actually taken a lunch break and gone out and gotten some food, or, had lunch with colleagues or whatnot. So that's another anchor that we're missing. So I recommend to anchor your circadian rhythm to take that lunch break, take some time away from your computer, eat slowly, chew your food. The microbiome is really important for sleep, and we can touch on that as well. But chew your food, clear your mind a little bit. And if you have time for another midday walk, I think that's a great idea. And that can help with the afternoon slump that a lot of us get into, especially when you're working from home. A lot of people are telling me they're feeling more tired than usual. So that can really help. I love to take my dog out midday, and he loves it too. So that's a good way to kind of anchor your circadian rhythm again and help you feel more awake and alert and more productive for the rest of the day. And then the last thing I recommend in terms of scheduling your workday is to use your evening, put a hard stop on the end of the day and use that evening commute to do the same thing, to do something transitional. So another issue that I'm seeing is that people are working from home, so there is really no end to the workday. They'll just keep on going, and then they're on their computers, and that kind of bleeds into the rest of the evening, and there's no separation, right? And that can mess with your cortisol levels and cause more stress and make it harder to sleep.
Yeah, next thing you know, you're doing your work in the bed when you're supposed to be getting ready to go to sleep.
Yeah.
Did I know anything about that?
I wonder what that would be like. Yeah, so creating some sort of a transition, and there are lots of things you can do for that, and there's no one right way to do it, but whatever works for you. So for some of my folks that I see in my practice, they'll decide to take a shower and change their clothes, right? So you change from your work sweats into your home sweats or whatnot, or go for a walk again, or do some meditation, or do a little bit of a quick workout or something like that. But something to kind of signal to your brain that, okay, workday's over, now we're going to transition into the evening hours.
Okay. So when we talk about circadian rhythm, I wonder, should we take a step back and just talk about like what that is? Because, we both studied integrative medicine, so this is something that's kind of our jam. But I wonder, as far as folks who are just tuning in, like, what does that mean exactly? What is your brain doing that creates this rhythm that we talk about so much and that we like to hone in on with our patients so much until they're like, stop talking about it.
Yeah, right. Until they're sick of it, right? Yeah. All my patients are sick about hearing about the circadian rhythm and body clock. Yeah, so the circadian rhythm, and I find the circadian rhythm so fascinating. This is one of the things that actually got me really interested in sleep and studying sleep, because there is so much overlap between circadian medicine and psychiatry, and circadian medicine and sleep medicine. And it's also a really ancient thing, the circadian rhythm. So back, just taking a little step back, the word circadian means, so circa means around, and then dia means day, right? So it's kind of it's the regulation of our day and night cycles. So for humans, our circadian rhythm is about 24 hours. So this refers to our internal clock, right? So our body clock runs on about a 24-hour rhythm, which is aligned with the day-night cycle. And that's what I find so fascinating, because this is our connection to nature. It's our connection to the earth. And every living thing on this planet has a circadian rhythm. And every living creature has a different kind of duration of their circadian rhythm. So underwater creatures, like creatures that live in the deep sea where there's very little light, they have a very different body rhythm than us surface dwellers who are exposed to sunlight. So for human beings, our circadian rhythm is about 24 hours. And what's even more interesting about this is that every single cell in our body has a little clock in it. So not only do we have a circadian rhythm in our brain, right? So our master clock is in the brain, but we have a circadian rhythm in our liver, in our heart, in our gut, every organ. And then even the microbiome, which is in our gut and composed of trillions of different types of bacteria and fungi and different organisms, even they have their own little circadian rhythms. So all of these rhythms, all of these clocks in our body they work synchronously to kind of regulate our hormone secretion, to regulate our hunger, to regulate our sleep-wake cycles, to regulate our levels of alertness, to regulate our metabolism, so many different things, right? So if our circadian rhythm, if our body clock is misaligned, which is one of the things that's happening with the pandemic for those of us working from home, like I said, we've lost a lot of those anchors. So our circadian rhythm is kind of like out of whack. So when our circadian rhythm is out of whack, it's going to cause sleep issues. It's going to cause problems with weight. It might be harder to lose weight. It's going to cause problems with brain fog and fatigue and difficulty concentrating. And it could even make mood disorders worse.
Yeah. And I mean, and honestly, also our ability to fight infection, we worry about during this pandemic, the hormones, our temperature regulation, all those things, everything really, it seems like every body function is somehow influenced, the more we look at it, by our circadian rhythm, that there's receptors in your gut for melatonin. And there's so many things that people don't realize that your sleep cycle is really kind of keeping in control. So to me, it makes perfect sense that you decided to hone in on sleep as a psychiatrist and as an integrative physician, because it really determines so much. And starting there, I think, is a great place for people who are just feeling overwhelmed and not really sure what to do, because 9 times out of 10, their sleep isn't good. And just getting that back in sync can make such a difference, it seems like.
Yeah.
So I love the going outside, because they found studies that being outside, they said, well, just 20 minutes will lower that stress hormone, that cortisol, and like you said, tell your brain when to start making the hormones to stay awake and stop, or just to get sleep happening later, and the ones for being awake to start going down, and basically telling your brain, hey, it's daytime.
Yes.
Which, we've gotten away from being in this industrialized society and being in front of the computer for things like Zoom or school, because of that blue light. So people have asked me that too, like, what's the story with the blue light? Why do I care about the blue light? Do I need to get the blue light glasses from Amazon? What are your thoughts on the blue light as someone who is focusing on sleep? And last I checked, blue light affects our ability to sleep. So that's probably a good thing to touch on.
Yeah, absolutely. So this is a question I get all the time as well. So the way that I look at it is you can think of blue light as being like daylight, right? Like the sky is blue. So that's one way to just remember that it's a signal to our brain that it's daytime. So when we're looking at blue light, it's suppressing that melatonin production. So melatonin is produced by the brain in the pineal gland in the brain in a state of darkness. So if you're getting exposed to blue light in the evening, it's telling your brain that it's daytime, and it's going to affect your brain's secretion of melatonin, which is a hormone that regulates our sleep-wake cycles. This hormone is not necessarily something that puts us to sleep. So melatonin is not something that's necessarily going to make you sleepy, but it's a signal, basically. So it's a body clock regulator. That blue light in the evening suppresses melatonin and tells your brain that it's daytime. So there's some interesting research, though, coming out on this, that it might not just be the blue light that is affecting our sleep-wake cycles, but also what we're doing on the screen. So the more engaging that, whatever you're doing on the screen is, the more it's going to wake you up at night. So for example, if you're doing an interview on live camera, like on a live webinar. That might be a little bit hyper arousing to do in the evening. And so it's not necessarily the blue light from the screen that's going to wake you up, but the actual activity that you're doing. So this is why TV might not be as bad as something like scrolling through social media on your phone.
Right.
So I always ask my patients what they're doing as well. So it's not just about wearing your blue light blockers and then like you're on Facebook scrolling through and like engaging in these, like very heated conversations sometimes that people can get into on social media. That's not, blue light glasses are not going to help you with that. So you also want to think about, okay, not only limiting your blue light exposure, but thinking about what activities you're doing in the evening that could be sending you into a hyper aroused state.
Okay. Yeah, that makes perfect sense. Because I mean, as a psychiatrist, we know that emotional state can have such an effect on where your brain goes. And just like sleep can affect your mood can affect your sleep. It's kind of this cycle. So kind of keeping check of both is really going to help you stay in that rhythm and keep you going. So that's great. What about your environment? Like, are there other things? There's the blue light. Folks talk about TV and if they should keep the TV on at night. I work at the VA part-time, and I've had veterans who, are dealing with some post-traumatic stress, and, or folks who maybe their spouse is now having to work outside the home because they're a first responder and they're trying to keep the family safe. And so they're nervous being home by themselves. And so keeping that TV on, and then they're not sleeping as well. And, the brain is still kind of listening to the TV. What are your thoughts on that?
Yeah. So my answer to that is it depends. Mm-hmm. I have a lot of patients who tell me that they fall asleep better with the TV on with something playing in the background because it helps distract them from their thoughts. And if it works for you, then that's okay. That's not necessarily a bad thing, but it's how it's affecting the rest of your sleep that's important. So then if you're waking up through the night and the TV's on and you're waking up because of the sound or because of the light, then you might want to think about using a sleep timer on your TV or something like that, or having some way to ensure that it's going to turn off and not disrupt your sleep for the rest of the night. So it's not necessarily a bad thing or a no-no. You just want to think about what impact it's having on you. And another thing I recommend to everyone, just sort of getting back to the blue light thing, is to really exaggerate the light and dark cues that you're exposed to. So, we were talking about going outside during the day, in the morning and midday. And then in the evening, you really want to think about exaggerating an environment of darkness in your house. So what that looks like is if you have dimmer switches, you can, put them on the lowest setting. You can use salt lamps or candles or something to create a nice orange glow. Mm-hmm. I always describe this as a cave-like atmosphere. So keeping it dark, but cozy and warm with some orange lights. Like my family always makes fun of me because I keep it like pitch black basically in the evening and we'll have on a few small lights. But what that's really going to do is it's going to help promote your natural melatonin production, and it's going to signal to your brain that it's nighttime, it's time to unwind, it's time to get quiet, and it's also going to help just kind of promote good sleep, and it's going to help you feel more alert in the morning as well, because you're creating this very, very distinct separation between day and night. Now, the thing with TV is that if it's a few feet away from you, it's usually not so bad, but I always recommend to dim the brightness on the TV screen as well, or on whatever screen you're using. So if you're watching TV, or if you're looking at, watching a movie on your iPad or looking at your phone or something, you can use the night shift feature on a lot of devices, which filters out the blue light, and it kind of turns the screen into a warm sort of orange or yellow color. So you can use that, and then also dim the brightness on the TV screen. So you really, really want to think about quieting things down, making it dark, and signaling to your brain that it's nighttime.
Okay, great. Now, for folks who maybe have tried those things and insist that, I'm still needing to nap during the day, I still feel like I'm sitting in my bed and not sleeping. Or, I need to have that drink of wine to make myself go to sleep. What are your thoughts on? I'm kind of throwing a lot of things at you. These are all things that we hear, right?
Yeah.
What's your approach with those things?
So a lot of different things we can kind of parse out there. So
Right.
One of the things is about napping. So there's sort of like, again, it's one of those things that depends.
Right.
And I know people hate to hear that answer because, it's nice if we can just say, okay, do this and don't do that, but it really does depend. So if you feel like you need to take a nap and it's still the first half of the day, then that's a sign that you're probably not getting good quality sleep at night. Okay. So if it's before like noon or, even before 2 or 3 p.m. and you feel sleepy enough that you need to take a nap, then you would definitely want to talk to your doctor about that and see, okay, is there something going on with your sleep? Is there sleep apnea or some other issue with sleep that needs to be addressed that might be causing that excessive daytime sleepiness, what we call excessive daytime sleepiness. So now the other thing is we all have a natural circadian dip. So remember that circadian rhythm is our body rhythm, and it's highest, our alertness signal is highest earlier in the day, and then we get a little bit of a dip, usually around 2 or 3 p.m. Pre-pandemic, this is when the lines outside of Starbucks would go around the corner, right? Everyone went
I remember.
Hit of caffeine.
I was ever in them. Yeah.
Yeah. We were never in those lineups, no. But so you get this like natural dip around 3 p.m. And traditionally in cultures like in Spain and Greece and even in Asian cultures, that's when you would have your siesta. Right. So you would.
Yes.
Yeah. Oh, yeah. I'm a huge advocate of siesta. I think we should bring those back. But, so unfortunately, our modern society is not set up for that. But we still get that dip. We still get that urge to sleep around 3 p.m. And so if you need a nap and if you can do it and you want to take a nap for like 20 minutes, that's okay. That's fine, as long as it's not going to interrupt your nighttime sleep. The problem is when people start napping for 45 minutes or longer, then you start getting into deeper stages of sleep. That's almost like, I think of it like a sleep bank. It's like you're taking money out of the bank, and so you're taking away from your nighttime quality sleep. So just pay attention to how you feel. So if you feel like the nap is hindering your nighttime sleep quality, but you still feel really sleepy during the day, then that's a reason to perhaps get an evaluation, even with your primary care physician or your psychiatrist, or even getting a referral to a sleep specialist.
Okay. Yeah. And then for folks who have started either using alcohol or, I hear a lot of like the ZQuil or the Tylenol PM, or sometimes they've seen a well-meaning physician and gotten some Xanax or some different types of sleep medication. What's the best next step for them if they're looking at trying to get a better quality sleep? Because I think there's some misunderstanding about what's happening when you take those kind of medications as far as what happens with your sleep there.
Yes. Yeah. So, one thing I always like to look at is, why is the person not sleeping? Like, why do you need a medication to help you fall asleep? And that's where we kind of take a step back and we look at, okay, is this a circadian rhythm issue? Are there some tweaks we can make to help you regulate your body clock better? Is this a sleep drive issue? So are you taking, naps during the day that are, ruining or reducing your sleep drive? And, that's something we can talk about in a moment as well. Or is this a mindset thing? Like, are you anxious about sleep? Or is there something else going on? Is there anxiety or depression or something else that might be contributing to sleep issues? So really getting to the root cause is important. And there's kind of like a 4-pronged framework that I use with people to help identify the root cause. So that's one thing, is to identify what the cause is. Now, it's not necessarily a bad thing to use sleep aids short term. I also prescribe sleep aids. So even though I really focus on behavioral sleep medicine, I do prescribe sleep aids from time to time. So sometimes we will use a little bit of a benzodiazepine or a Z drug. Those are drugs like Ambien or Lunesta. Sometimes I will use those short term. And short term means like 1 or 2 weeks, not much longer than that. But I do have people who come to me on these drugs who have been on these drugs for years and years and years. And so we'll work on tapering off and bringing in some other elements to help support them with sleep. But what's happening with these drugs? So there's some data showing that certain benzos and Z drugs like Ambien can actually inhibit the deep restorative sleep cycle, which is stage 3 sleep. So there's some evidence that these things can actually inhibit deep sleep and actually make your sleep worse over the long run. And that's one of the reasons you don't want to be using these drugs long term. As far as medications like ZzzQuil or Tylenol PM, these are basically Benadryl-based drugs, right? And so, yeah, they're sedating, but they can cause a morning hangover. They can make people feel a little bit foggy. And what I've seen is when people use these long-term, either they develop a tolerance where the drug doesn't work as well over time, and then they have to take more for it to work. Or sometimes they just start feeling like really depressed, or they have a lot of trouble with concentration and brain fog, and it just causes more problems in the long run. And then some of the problems that they cause are the very issues that you were trying to treat in the first place. So for that reason, you know, it's really, really important to get to the root cause and figure out non-pharmacological ways to help improve sleep.
Yeah, I mean, there's also the safety issue. You know, when folks, you know, you've mentioned maybe start a Xanax in their 30s because, you know, a pandemic happened and they were stressed out, but then a well-meaning physician continued it for years and years. Next thing you know, you're in your 60s and your metabolism is changing. Yes. And you're increasing, you know, the dangers of it, you know, falls, you've mentioned cognition. You know, right now we have a pandemic that affects your lungs. These are medicines that suppress your breathing. And yes. So these are, you know, having that and the flu and taking a cold med, that can be a lethal combination if you're an elderly person. Yes. And, you know, folks don't necessarily realize that. And so they think they're doing the right thing and that they're sleeping. But like you said, you're not getting into that deeper sleep. And so your brain really isn't able to do what it needs to do to kind of restock the shelves is yes. One way I've talked to people about it. You know, it's like the grocery store in the middle of the night. You're restocking all the shelves. Your brain is breaking down the proteins and reformulating your cells and doing all the things it needs to do to stay healthy. And if you're not allowing it to do that, you know, you're going to have all these things that we're talking about that aren't on the good side of things. Yeah. So, I mean, I know we both used some other types of substances, like some supplements. Are there favorites that you recommend to folks or talk to folks about, or any thoughts on those?
Yeah, absolutely. And I just wanted to quickly piggyback on what you just said, which is absolutely right. You know, like, so when you're sleeping, sleep is a very active process in the brain. Like it's not just turning off, you know, flipping a switch. And, you know, when you're on it, you're awake, and then when it's off, you're asleep. It's a very complicated process that's happening when we're sleeping. And so we are restocking the shelves. I love that analogy. And another analogy I use is that it's like a janitor coming in and sweeping out all the gunk that is built up on the floor during the day, right? Because we build up a lot of toxins during the day. And so deep sleep is really important for the brain to clear out all of those toxins and refresh and recharge the brain. And I have some statistics here I can share that when people are taking, and when people are taking sleep aids, especially, so when I say sleep aids, I'm talking specifically about benzodiazepines, so medications like Xanax or Klonopin, and then the Z drugs, so medications like Ambien, Sonata, Lunesta, and so forth. So studies show that people who take these regularly have a 5 times increased risk of problems with concentration and memory, 4 times increased risk of daytime fatigue, twice as high of a risk of falls and fractures, especially of the hip and wrist, which is a big concern for our older folks, and then twice as high of a risk of having a motor vehicle accident while driving. So, you know, like you said, even if you feel like, okay, I'm getting good quality sleep, whatever that might mean with these drugs, they are not without risk. They can be quite serious and quite dangerous. And even parasomnia is another side effect, another unusual side effect that can happen with Z drugs. So, for example, with Ambien, I've seen patients who start, so parasomnia is a behavior that happens during sleep, usually like sleepwalking or sleep eating. And so I've had patients who would get up and had one particular person who was eating candles at night and not even realizing it. And they would wake up the next morning and there'd be like remnants of candle and they wouldn't feel well. And it was from the sleep drug that they were taking. There have been reports of people sleep driving not knowing that, they get up in the night and they get into their car and they start driving and they're asleep. Or, falling out the window. There's actually been 20 cases of death because of these types of behaviors that can happen in sleep. So I just wanted to emphasize that these drugs are serious. They're right. They're not something to be taken lightly. So having said that, yeah.
Well, I was going to also mention just the loss of memory, something that I usually tell folks if I am using a Z drug, one of the hypnotics with them, a lot of them affect your memory. So I tell them, you're going to be taking this for a period of time. Make sure your spouse or partner knows that once you take this medicine, all bets are off. Any discussion, any argument, the next morning you'll have no clue what was said.
Right, exactly.
That be understood, right? Because you can have all kinds of miscommunications amongst family members because they don't realize someone's on this medicine.
Yes. Yeah. It's like having a few drinks, right? Like you're not going to have a serious conversation with someone after having a few drinks. So it's the same idea. Yeah.
So we were going to talk about the alternatives that we've used as integrative medicine physicians. And you mentioned Ayurveda as well. I think you have some extra training that's even more fabulous that'll help us understand even more some of the things we could do outside of the traditional medicine that people think about.
Yes. Yeah. So as far as supplements, the thing with supplements is that we don't want to fall into a trap where we're using them the same way that we would use medications.
Right.
So that, because that's something that I see a lot, is that people will, they'll wean off their medication, and now they feel like, I can't sleep without my magnesium, or I can't sleep without my, inositol or valerian or whatever it is. So I just wanted to kind of bring that up and let people know that supplements are part of the program, but it's not the whole story, right? So when we're looking at restoring good quality sleep, it's like putting a jigsaw puzzle together. There are lots of different pieces that we have to address, and supplements are just one piece of the puzzle. So we need to make sure we're looking at every other aspect of your behavior and your daily schedule and stress management and so forth that are going to help you sleep better. But as far as supplements, a few of my go-tos are magnesium. I really love that. And because about 70% of American adults are deficient in magnesium. We're just not getting enough of it from our diet. And there's a lot of different reasons for that. So magnesium is really great, especially for people who have a little bit of anxiety. If you have muscle cramps or muscle pains, or if you're just generally restless, magnesium is a great supplement that can help with sleep. L-theanine is another one that I use a lot in my practice. And L-theanine is an amino acid that is usually found in tea, but taken as a supplement. It doesn't have any caffeine in it, so it's not going to affect your sleep drive. And it's really good for helping to calm the mind and with relaxation as well. And it can also help people with focus as well. So it's really interesting in that regard.
The relaxed focus. It's really interesting how the brain works.
Yes. But I have more information about supplements. I have a few different supplements in my supplement guide with more details about how they work and how to take them.
Yeah, so I think with that, we're just a little bit after the half hour, and I know folks are usually on their lunch time here in Central Standard Time, and so if folks want to find out more information about the supplements or about how to get in contact with you, I think you're planning a course in sleep coming up. What's the best way for them to find out about you?
Yeah, so I do have a sleep guide where I talk about supplements, I talk about Ayurveda, I talk about cognitive behavioral therapy for insomnia and different principles to help people improve sleep. So that's available on my website at intrabalance.com/sleep guide. So I think that's up there on the screen. So intrabalance.com/sleep guide. And I do have a course coming up that's going to come out in January of next year. So you can stay tuned for that. And my course is going to be essentially a step-by-step guide. It's a 30-day program, step-by-step, going through how do you optimize your day to improve your sleep. So good sleep starts during the day. So I'm going to be walking people through some of these things that we talked about. So how to structure your work day, what types of foods can help you, what time you should eat your food, supplements that could help, using light and dark to your advantage and leveraging the natural body rhythms, your circadian rhythm. So it's going to be a really simple but really effective program. This is what I teach patients in my private practice. So I'm kind of packaging it all up and making it available to the public.
Oh, I love that. And what a great way to start 2021, which is going to be an amazing year. So if folks here in New Orleans are interested more in talking to me about their sleep or anxiety or depression, I am an integrative psychiatrist here, Dara Wellness. That's my website, darawellnessnola.com. You can look there. I have free discovery calls that you can reach out and we can talk about what your needs are. And if you are watching us on YouTube, please like and subscribe so you can find out more about the different episodes of Biggest, Easiest Ways to Wellness, which are every Thursday at noon Central Standard Time. Not happening next week because Turkey Day, gobble, gobble, but we'll be back the following week. And Nishi, thank you so much for joining today. Like I said, I've had so many people ask me about sleep. I think you're a goddess that has taken this on. It's really something that can affect people their entire lives. And to have someone like you who's really learned all you need to know about it and is so willing to share your knowledge is just a blessing. And I thank you for that.
Oh, thank you for having me. It was a pleasure.
Yeah, absolutely. All right. Bye, guys.